Hi everyone, welcome to another radiographic anatomy session. This time around we'll be talking about the wrists, bones and its alignment. Let us now start with knowing the standard views for the wrist. There are AP, lateral and oblique views. However, there are supplementary views or the scaphoid view, then the deviation views, that is ulnar deviation and radial deviation. So we're going to start with the carpal bones. The carpal bones, and there are 8 of them. The proximal end of it have 4 bones, while the distal end have 4 bones. So we can start with from lateral, then we move inwards medially. What we see here is a scaphoid, which is resting on the radius. Medial to that is the lunate, and lateral to the lunate you have the tracheatrial or tracheatrial. Then anterior to that is most lateral to the lunate, is the pisiform. If you look at the distal row, you have the trapezium, which is at the base of the thumb, and you have the trapezoid, which is medial, and medial to the trapezoid you have the capitate. The capitate is the largest bone in the wrist of all the carpal bones, and lateral to that you have the hamate. And the hamate is unique because it has a hook, which others don't have. Some figures you see in red is for us to go a step further. And going a step further means that because the wrist is used for bone age, as per maturity of the bones, of the carpal bones, so you can really use it to determine the age of an individual in pediatric age group. The first bone that forms usually is the capitate, which is the biggest and most central, and it comes up between 1 and 3 months. The next one is the hamate, which comes up within 2 to 4 months. And subsequently, you have the tracheatrial, which comes up between 2 to 3 years, while the lunate is formed 2 to 4 years. The scaphoid is formed between 4 to 5 years. And furthermore, at the distal row, you have the trapezium. Trapezium forms between 5 to 6 years, whereas trapezoid forms between 6 to 7 years. The pisiform forms between 9 to 12 years. So with this, you can have an idea of the age of a child before 12. Subsequently, you'll see that the ulna is smaller, whereas the radius is broader. The radius is actually the one that takes part in the wrist joint, whereas the ulna has a fat pad around here that helps it to cushion the effect of the tenia region. The lucencies we are seeing in this area shows that these are joints. And there are joints like you have in the radiocarpal joint, which between the radius and the carpal joint, mainly the carpal bone, scaphoid and lunate. Then in between the carpal bones, you have the intercarpal joints, okay, in all of them. So this lucency indicates joint spaces, and this is to say they are well aligned. And distally, there are other lucencies which you can see between the distal carpal bones and the metacarpals. So this is the thumb, which is the base. This is the base of the fifth metacarpal, and this is the fourth metacarpal. This is the third, and this is the second, and this is the first metacarpal. And so there are joints in each of these, and they are called carpometacarpal joints. Subsequently, when we discuss the hand, we'll be able to see the metacarpals and the phalanges in that order. In this specifically, this arrangement is such that if there's any malalignment in any of these carpal bones, then that shows that there's an abnormality, which can be further investigated with other views and the supplementary views as well. So, in summary, we should be able to identify the carpal bones and those ones in the proximal row and the distal row, as well as the radiocarpal joint, intercarpal joints, and carpometacarpal joints. So these are not difficult to remember, and it's very important, especially in pediatric age group, to know when these bones mature. That guides you in talking about the bone age. So thank you very much. I hope to see you in my next video. Remember to like, subscribe, share, and turn on the notification button so that we can launch the next video. Thank you.